Hi, I'm Dr. Jim Thompson, the Medical Director here at Child Cardiology Associates. In this short video, we're going to talk about PFO and stroke and whether or not a PFO should be closed. So, about 1 out of 5 people have PFOs. Most of these people, millions and millions and millions of people around the world have PFOs and spend their whole life without having any problem related to their PFO. So if a PFO is just found in a patient and they have no reason to close it, then it should be left alone. However, if someone has had a stroke and are found to have a PFO and there's no other reason identified that they have had a stroke, then closing the PFO should at least be considered. It doesn't mean it should be done, but it should be considered. There's been a lot of debate in the medical community over the years about whether or not PFOs should be closed in stroke patients. At this point, the best information we have about making this decision is based on data from the RESPECT trial. This is a study where there were about 1,000 patients who had PFO and had a stroke and no reason to have their stroke, and they were divided about 50-50 randomly, and half of the patients had their PFO closed, and the other half just took standard medical therapy to prevent recurrent strokes. They have followed these patients over time to see who's at more risk for recurrent stroke. We have about 5-year follow-up data on this patient population, and it shows that if someone's PFO is closed with a transcutaneous device, that they have about a 70 to 75% reduction in their risk of recurrent stroke if they have their PFO closed. Again, this isn't saying that all patients with PFO and stroke should have their hole closed, but it should at least be considered. There are some risk factors that we're starting to identify that may put patients at increased risk for recurrent stroke, such as having something called an atrial septal aneurysm, or in patients who have a high volume of blood crossing from the right side of the heart to the left side of the heart through the PFO. So if you're one of these patients, you should discuss this option with your cardiologist. So the best data we have to date is from the RESPECT trial. We now have about 5-year follow-up data from this study. The blue line is patients who had their hole closed or their PFO closed with a device. The red line is the group of patients who took standard medical therapy alone without having their hole closed. These patients are then followed over time to look at their risk of having a recurrent stroke or a repeat stroke. You can see very clearly here that over time, patients who've had their hole closed with a device are far less likely to get a recurrent stroke than patients who did not have their hole closed and take standard medical therapy alone.